Hundreds of thousands of people now being pinged with the COVID tracing app and what it's meaning to self-isolation, the impact it's having on many businesses up and down the country. Delighted to say we're joined by the Attorney General, Lucy Frazer, who from the government this morning. Good morning to you, Lucy. Can we just start with that point about the sensitivity of this app? We know people apparently being pinged through their neighbours' walls at home and having to isolate. This is having a big impact on the economy. You are changing the rules next month if you've been double jabbed. Why not do that tomorrow?
Well, we're obviously at all times following the science, and it's really important that if you are pinged because you've been in contact with somebody, that you do self-isolate, because that's how we keep the infection rates down. But you're right to say we are changing the rules. We're changing them on the 16th of August if you are double vaccinated. But we're also are carrying out pilots at the moment in relation to whether it would be appropriate for people to, when they're pinged, to take a test instead of having to self-isolate for that 10 days.
And say that, I know you're saying things are changing, but my point is, you know, there are apparently, according to The Sun this morning, 2 million people across the country who may well be self-isolating. We've got, you know, car factories saying that they can't operate. We've got film studios saying that they've had to cancel productions. We've got bars and restaurants saying they simply do not have enough staff. They cannot wait a month. If we think it's a good idea that if you're double jab, you don't have to self-isolate, it happens in the US, it happens elsewhere in Europe. I don't understand why we cannot do that tomorrow. The science, frankly, is there. We know jabs work. Let's do it tomorrow.
So we are taking this measure, but you'll remember that we were going to, for example, open up more widely on the 21st of June a month ago, but the government took the decision to delay that until Monday, so a month later, to ensure that more people were vaccinated. We've now done that. We know, as you say, there's a link between infections and hospitalizations being broken by the vaccination, but it is important that we get those vaccination numbers up before we take all measures away. We are significantly reducing the restrictions on Monday, and I've been asked this morning by several media outlets whether we should be taking them away at all. And now you're asking me the reverse, which is taking away some of the other protections. So it's a balance. We're taking a balanced approach in order to ensure that we can live with the virus.
Isn't it a little bit complicated, though, that Jacob Rees-Mogg has said that he doesn't want MPs to wear masks in the Commons, but yet the sort of mandate and the advice is that we wear them in our day-to-day lives? I mean, how can you escape kind of accusations of hypocrisy when there are sort of things like that coming out of the government?
What we're doing on Monday is taking away the legal requirements to wear masks. But what we're then saying is that it'll be a matter for personal responsibility as to whether you wear one or not. And layering on that, if you run a business or you're a mayor, you will think about what's appropriate for your company or your transport network and set the rules accordingly. In the House of Commons at the moment, we all wear masks. We wear them in the chamber. We wear them to walk around the very vast and open spaces around the palace. And of course, the House of Commons will make its own determination about what is appropriate, as will other businesses around the country.
But frankly, we know you talk about personal responsibility, but the official government advice is, and the Prime Minister uses this word, is that the expectation is that he expects people to carry on wearing masks in crowded areas. And you've got government advice saying this is the expectation, this is really what we want you to do at the end of the day. And then you've got members of the government suggesting that they're not even going to follow that advice. You can understand why people are confused and, frankly, pretty angry about it.
Well, the rules of the House of Commons will be set by the House authorities, and I'm sure that members will be abiding by those rules, as I have done throughout the pandemic. As I walk around the House of Commons, I see everyone wearing a mask and abiding by the rules.
Can we just finally move on to what's going to happen with social care? In the papers today, talk about the Prime Minister potentially backing a new tax when it comes to try and sort out this enormous issue. Is the government looking at potentially introducing or increasing taxation in order to pay for social care?
Well, you know that the Prime Minister has been thinking about the issue of social care for some time and has committed to bringing forward a plan. I can't announce that plan today. I don't know what that plan is, but there will be an announcement in due course.
In saying that, we recognise that this is it's a major issue that the government have been promising for the last 2 years to get to grips with. Frankly, where the public finances are, someone's going to have to pay for it. I mean, on a point of principle, as a Conservative politician, where is your balance? Is it with increasing taxation for us all, or is it essentially putting the burden on those older people and using some of the assets that they have? Because there's it's a philosophical debate in many ways, isn't it? Or it's a debate to be had, but it's one where you either believe that we all collectively have to play our part, or actually that the people who are using the care should take a greater lion's share.
Well, of course, the social care and how we pay for it is a huge issue and one of the biggest challenges that faces the government. And with an increasingly older population, we absolutely need to identify how we are going to tackle that and who is going to pay for it. Over the course of the pandemic, we've spent an additional £3 billion on social care, and we committed to a billion outside of that when the Prime Minister was first elected. We need to ensure that the funds are available, and you're right to say there are a number of ways of funding that, and Andrew Dilnot came up with one of them. But I'm afraid you're going to have to wait for the announcement that the government makes to set out how we are going to deal with this very important issue.
OK, and just very finally, let's go back to COVID if we can, and the number of infections, because they have been increasing, obviously quite substantially, up 50% in the last week. Chris Whitty is suggesting that we are far from the end of this and that we might see frightening numbers of hospitalisations in a matter of weeks. Yet the Prime Minister was suggesting yesterday that the worst of the pandemic was behind us. Who do we trust on this, the Chief Medical Officer or the Prime Minister?
Well, I think the Prime Minister and the Health Secretary and Chris Whitty have all been very clear that infection rates will rise as restrictions are eased. And although there is a weakening of the link between that and hospitalisations and deaths, it isn't cut. So we will see hospitalisations. And unfortunately, it follows from that there will be some deaths. But what Chris Whitty also said was that we're a long way from where we were when the pandemic first hit in March, and we've learned a huge number of things about this virus and how to tackle it. So as well as the restrictions that we've been discussing and the vaccination program that we all know about, we've also got the genomic work that's been done to identify new strains. We've got drug treatments when people go into hospital. And so yes, when we lift the restrictions, we will see those numbers come up, but we have so many ways to tackle the virus.
But he says, I don't think we should underestimate the fact that we could get into trouble again surprisingly fast. This is Chris Whitty, get into trouble again surprisingly fast. If that is the case, if it becomes unsustainable, I mean, the government would surely look at imposing restrictions again of some sort, or rolling things back.
Well, the Prime Minister has been very clear that he hopes that this is irreversible, but hasn't ruled out, of course, if there was something that meant that deaths were significantly increasing, of course the government would take measures to protect the public.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.